5 years ago, Dr. Larry Chu did a really brave thing. He was brave enough to invite patients to an academic medical conference. And we have to remember that 5 years ago, patients were not at the table or in the room, and it was a really rare thing. And we met in the basement of this building, right downstairs, right below us, hoping that 5 people might show up and sit in a few seats in the front of that room, and that there might be an audience to come. And what happened was that we had standing room only in the front of that space for 20 people who showed up and said, "I'm an e-patient and I want to talk." And the room was packed, like it was standing room only. And we could only get through introductions as we passed the mic down the line. And it was incredible because the pendulum was way over here, right? We were in this really kind of conservative space still in healthcare where that felt kind of dangerous and risky. And being a patient and saying, "I demand to be in the room too," required tremendous courage. And it's the courage to bust down doors and mental barriers and models. And what's happened in the years following is the pendulum has swung way over here. In MedX, we started saying patients are the VIPs. It was incredible, and you're sitting in the front row right now. And it was brave of the doctors and the academics and the researchers to keep coming back to a medical conference that was increasingly about people. And now we're in this really incredible, beautiful space, this middle that is bravely co-creating and disrupting together. In this space, there is no us, there is no them. This weekend, there is we. Bravery was Dylan yesterday. He showed us how an artist creates their work. He was brave enough to show us the brush strokes and the color choices that make up the poetry of his true intentions. And it was brave of everyone in this room to join him and support him in that moment. And we were all together as he co-created. And friends, that's what co-creation and disruption looks like. So this year, I have the exceedingly amazing honor of working very closely with Dr. Chu and our program executive board and our other advisory boards and all of you as the chair of the executive program board. And I want to ask for your help. And I need everyone in this room, I need everyone watching, I need the people you know who aren't here. And over the next year, we have to think about what these brave conversations are going to be. And we need your help to identify those conversations, the kinds that we can only have here in this room, the ones that take the courage and the strength and the conviction to sit in this space together and be with someone's pain or their joy, and ask ourselves, how do we use that moment? How do we use this co-created space and time to make healthcare and, frankly, our entire world better? I'm really excited to be joined by a board and an organizing team of people who also bravely want to go where no academic medical conference has gone before. So I ask that you tweet us or email us or that you grab us in the hallway today and you think about what is the brave conversation that we ought to have over the next year. I look forward to seeing you back then. Thank you.